Its own discoverer calls it a spectacular virus, one of the most lethal, and now out of control in West Africa, according to Médecins Sans Frontières, where the deadliest outbreak on record is spreading like wildfire. And it is gruesome. Most of those who get it will die through uncontrollable bleeding, as hundreds are now succumbing in Guinea, Sierra Leone, and Liberia. As President Ellen Johnson Sirleaf calls this a national emergency, health ministers from across the continent are urgently gathering in Ghana right now to figure out how to try to combat this crisis. Just today, the Red Cross was forced to suspend its operations in southeast Guinea, ground zero for the current outbreak, when a group of armed attackers threatened its health workers there. Ebola was first identified almost 40 years ago, and my guest tonight, Professor Peter Piot, is the man behind the discovery. He tells me how poverty, plus superstition, fear, and ignorance all contribute to help spread the disease. Professor Piot, welcome to the program. You are the co-discoverer of this virus. Right now, the World Health Organization and other doctors are saying it is out of control in this area of West Africa. It's the worst outbreak ever that they've recorded in this part of the world. Are you surprised?
I am surprised, and it is true that this is unprecedented for several reasons. One, first time in West Africa that we have such an outbreak. Secondly, this is the first time that 3 countries are involved. And thirdly, it's the first time that we have outbreaks in capitals, in capital cities.
As opposed to in remote rural
areas. All other outbreaks were in remote areas, forest areas.
Let's just look at this map when we talk about 3 countries involved. You've got Guinea, 303 deaths so far, Sierra Leone, 99 deaths, and Liberia, 65 deaths. The president of Sierra Leone is calling this a national disaster and emergency. Why is it significant that it's urban, and what does it mean for people? Remind us how bad it is.
Well, Ebola virus infection starts with, something that looks like the flu. Headache, fever, maybe diarrhea. But then you can develop very fast bleeding that's uncontrollable, and that's how people die, although not all of them, 80-90%. And the problem is that what we can do is, in theory, very simple. You soap and gloves, that's what you need. You don't reuse injections, syringes.
Which is obvious.
Obvious.
So you're saying very basic sanitary measures can control this?
Absolutely. These are outbreaks. This is an epidemic of dysfunctional health systems, because who dies first? It's nurses and doctors who take care of them. And then the next wave is around funerals, when the body is cleaned and washed, and these bodies from someone who dies from Ebola are full of virus.
So there's this vicious cycle, if you like.
Exactly. And then we have also the fear of the virus, and the lack of trust in government, in the health system, is as bad as the actual virus.
What does out of control mean to you and me, to the people who are living here in West Africa?
Well, first of all, when I see these figures, every day there are new infections, new deaths, meaning that this epidemic is still alive and well and spreading. That's one thing. Secondly, because it's also happening in, urban populations, isolating the patient, finding the contacts is far more difficult than when you're in a remote rural area where everybody knows each other and where the community leaders also can help.
You've called it a spectacular virus. Why is it so spectacular, so dangerous?
Well, it's spectacular because once you get it, at least with this strain of Ebola, you've got like a 90% chance of dying. That's spectacular by any standard. One of the most lethal viruses that exist. On the other hand, you need really close contact to become infected. So just being on the bus with someone with Ebola, that's not a problem. It's also not aerogenic, so it's not transmitted through droplets and so on. So it is really something that in theory is easy to contain. But in practice, there are beliefs when you think this is witchcraft, when people are coming to get the diseased relatives and the dead bodies, take them away. That's the problem.
Well, interestingly, the president of Liberia says that anybody caught hiding an Ebola victim will be prosecuted. But how did it get to the urban area? Why has it spread so rapidly to that area?
Well, first of all, we are not 100% sure where this virus comes from. Probably from some bat.
Isn't that just incredible, though? I mean, you discovered this in 1976, and you still do not know for sure what is the host organism.
Indeed, and a lot of research has been done, but not enough. And as long as we don't know where exactly this virus hides outside epidemics, then we can't map where the risks are. And we are an accidental host, because a virus that kills the host in 1 to 2 weeks, that host is not that interesting for that virus because it has to find another host. So we're an accidental host. So what happens is that a person is infected, is hospitalized, infects other patients, and particularly healthcare workers. They're buried somewhere. Around that funeral, people become infected when they're touching the body and so on. And then they get ill, and then they go somewhere else, and then they go to relatives in town, maybe because they hope to have better health care. That's how it's.
Do you think it's going to spread more?
Well, I'm very concerned about Mali, for example. When you see, these borders are very porous. People cross them. There's a lot of commerce and so on. And Senegal, Mali, the Gambia, Ivory Coast, I would be very worried. And
so this could explode into a really mega crisis.
I think so, and it is already a mega crisis with this number of deaths that are increasing. For me, this is a reason for a state of emergency, in these countries.
So what should they do? Quarantine the whole area? What does it mean, a state of emergency?
It means that you need a combination of nearly military type of control measures, isolation, quarantine of those who have the disease, but also their relatives to make sure that they're not spreading the infection. And secondly, community mobilization. Information can save lives here.
Isn't that just the problem, though? People are uninformed and scared.
Absolutely. And the fear of the virus and running away from health services, that contributes to perpetuate the spread of Ebola virus.
Let's go back to 1976 when you were a younger man and you actually co-discovered this virus. It was in Zaire,
yes,
now the Democratic Republic of the Congo. How did you find it?
Well, we were working then in the Institute of Tropical Medicine in Antwerp, where we got a blood sample from a dead nun, a Flemish nun working in Zaire. And the clinical diagnosis was yellow fever. And we were equipped to isolate the yellow fever virus. But then something completely different came out of it. And under the microscope, it looked like kind of more like a worm-like structure, as we see.
As we can see, yes.
Very big virus. And there was only one other virus known to be of that shape. And then the virus was confirmed at the Centers for Disease Control in Atlanta that it was not Marburg, but something new.
Well, why no cure?
Well, first of all, in these days, we had no clue how the virus was transmitted. So the first thing you need to know in terms of prevention, how is it transmitted? Is it through blood, through food, to coughing, sex, what have you? And that's very important when to contain an epidemic. And we found it was close contact and reutilizing syringes and needles. Now, treatment, there are some experimental treatments that have been tried out in monkeys, but never in people. And so the problem...
Should it be?
I think it should be, because in this case, there are so many people who are ill. It's a way of trying to find out whether something works, and I think it will reinforce the belief and reinstall the belief of people in health services.
Is this virus becoming more resistant?
No, I don't think there's any evidence for that it's becoming more virulent or more resistant.
Or morphing in any way?
No.
Because the big story in Europe right now, Prime Minister David Cameron is launching a campaign against these sort of super bugs that are resistant to antibiotics. They say something like 5,000 people in England, 25,000 people around Europe die every year because of resistance to antibiotics. Am I getting that right?
Absolutely. This is one of the biggest challenges of the future, and that is the possibility that some of the very banal bacterial infections will be untreatable, and then major surgery will become untreatable. People admitted to hospital will die from these infections. We already have some strains like that for tuberculosis. And so I fully agree with Prime Minister Cameron that this is one of the big scientific and public health challenges of the future.
And what do we do about it?
First of all, prescription of antibiotics needs to be more disciplined, only prescribing and taking them when it's absolutely indicated. Otherwise, that contributes to developing resistance. Secondly, a lot of antibiotics are given to animals, and that contributes to the development of resistance because the food that we have and that is full of antibiotics. And thirdly, there's been market failure in terms of developing new antibiotics. We need new approaches, new antibiotics, and that's where a number of new initiatives are being taken by the UK government, by WHO in the US. So I think now, because of the greater awareness, there is hope. But we're running out of time.
Professor Pieter Piot, thank you very much indeed for joining me.
Thank you, Christian.